Hello, my name's Jake. I'm one of the medical students. Can I just check your name and date of birth, please?
It's Taylor Rose, 12th of the 12th, 91.
Fantastic. How can I help you today, Taylor?
I've just had a bit of breathlessness and a little bit of chest pain as well over the past couple of days.
Okay. Can you tell me a little bit more about these symptoms?
So I was just taking the dog for a walk a couple of days ago, and I was sort of going uphill and noticed I started to feel quite breathless, and I was sort of breathing in. I was getting quite a bit of chest pain as well.
Right, okay. Can you tell me a little bit more about the chest pain?
So it's quite a sharp sort of stabbing pain.
Okay. So for the past 2 days, you've been kind of getting breathless, especially when you're kind of walking the dog, and then also notice this kind of chest pain as well. And whereabouts is the chest pain exactly?
So sort of on like the right hand side.
Okay. And does it come on suddenly when you're kind of exerting yourself?
So the chest pain is like just if I'm taking a deep breath in.
Just when you're taking a deep breath in. Okay, I've just got a few more questions about that chest pain. So you noticed it kind of worse when you take a deep breath in, and it's on that right hand side, and
Yeah.
it's kind of sharp and stabbing. Does it move anywhere, or does it stay in that kind of right hand side?
It just stays there. Yeah.
Okay, and apart from taking a deep breath in or when you're exerting yourself, have you noticed anything else that makes it worse?
No.
Have you had any other symptoms when it comes on?
No, just the breathlessness if I'm sort of overexerting myself.
Okay, so no kind of feeling like your heart's racing or anything like that?
No.
Okay. And does anything make it better at all?
Not that I've noticed.
And you've noticed this over the past kind of 2 days.
Yeah.
Has it been getting kind of worse or better?
Just been the same.
Okay. And it's only when you kind of take a deep breath in that you get it?
Yeah.
Okay. If you were to scale it on a kind of score of 1 to 10, 10 being the kind of worst pain you could imagine, where would you score it?
It's not too bad. It's only about a 4 out of 10, I'd say.
Okay. And have you noticed any leg swelling at all?
I have actually had a bit of swelling in my calf.
Okay. Can you tell me a bit more about that?
So that started about 5 days ago in my left leg. I was going to make an appointment with the GP, and then I had the breathlessness.
Okay. And with that kind of swelling to your calf, have you noticed any pain or redness?
It's been a little bit sore, yeah, and a little bit red as well.
Okay. I've just got some more questions just to think about what could be causing your breathlessness and chest pain, as well as this leg swelling. Have you had any recent long-haul flights at all?
Yeah, I came back from Australia about a week ago.
Okay, so before the swelling started?
Yeah.
Okay. And have you had any cough at all?
No.
You haven't been bringing up any blood at all, coughing
No.
up any blood? Any wheeze at all with your chest?
No.
No, okay. And do you suffer from any heart problems?
No.
Okay, you don't have anything that you've had similar to this in terms of chest pain?
No, I've not really had chest pain before.
Okay, fantastic. And have you had any recent illnesses?
No, I've been fine, really.
Any fever at all?
No.
Or night sweats?
No.
And have you had any trauma or injury that could have caused your leg swelling?
I don't think so, no.
No, you've not had any period of kind of prolonged rest or where you've been not very active at all?
Not apart from the flight from Sydney.
Okay, fantastic. And do you get very heavy periods at all?
Not usually. They're okay normally.
Okay, is there any chance you could be pregnant?
No.
Okay. And with this kind of chest pain and breathlessness, is there anything that you thought might have brought it on?
I'm really not sure. I don't know why it started.
Okay. Anything you're worried about?
I've been a little bit worried about the leg swelling. My mum's had blood clots in her legs before, so I've been a bit concerned in case it's the same thing.
Okay. So she's had a number of different blood clots, has she? Is she on any medications for that?
She's on blood thinners, yeah.
Okay. And does she suffer from any medical conditions?
I'm not sure.
No, okay. And so with this kind of concern about blood clots, was there anything you were kind of hoping or expecting today?
I was just hoping for some blood tests and maybe a chest x-ray if possible.
Okay. I'm just going to recap what you told me so far. So for the past 5 days, you've noticed swelling and pain and redness to that left calf. And then you've also had some breathlessness, worse when you take a deep breath in, and some chest pain in that right side, which is quite sharp and stabbing in nature. Do you suffer from any medical conditions?
No.
No. Do you take any regular medications?
I just take the combined contraceptive pill.
Okay. And do you have any allergies at all?
No.
No. You've already mentioned about your mum and the blood clots. Do you know if there's any other family history at all?
I don't think so.
Nothing else that runs in the family you're aware of?
No.
Okay. And do you mind me asking what you do for work?
I'm a social media influencer, mostly in travel and fashion.
Okay. And do you live with anyone at home?
No, I just live with my dog.
Okay. And do you smoke at all?
Yes, I do.
How many cigarettes do you smoke?
I think about 10 a day at the moment.
And how long have you smoked 10 cigarettes a day for?
About 10 years.
Okay. Do you drink any alcohol?
Maybe once or twice a week.
Okay. And roughly how many drinks would you have when you drink once or twice a week?
Maybe only 1 or 2 glasses of wine, something like that.
Okay. Do you take any recreational drugs at all?
No.
Okay, I'm just going to summarise everything you've told me, and then if there's anything that's incorrect, please do let me know. So you noticed kind of swelling and pain and redness to that left calf 5 days ago after a long haul flight, and then over the past 2 days you've noticed breathlessness and chest pain in that right side of your chest, worse when you take a deep breath in. Is there anything else you'd like to add, or is there anything else you wanted to mention?
I don't think so.
No. Okay, well that's the end of the consultation. Thank you very much.
Thank you.
Today I spoke with Taylor Rose, a 32-year-old woman. She presented with shortness of breath and right-sided pleuritic chest pain. The chest pain does not radiate anywhere and is associated with taking a deep breath in. She does not have a cough or fever, and she has not had chest pain like this before. Taylor also reported a left swollen, red and painful calf, which started 5 days ago, not long after a long haul flight. She does not have any significant past medical history. She's on the combined oral contraceptive pill and she has no allergies. On review of her family history, Taylor's mum has had recurrent DVTs and she is on lifelong anticoagulation. Taylor lives alone. She is a current smoker with a 5-pack year history, and she drinks 1 or 2 glasses of wine a week. She is concerned that her symptoms might be related to a blood clot and would like some further investigations into this. Based on the information given so far, the most likely diagnosis is a pulmonary embolism secondary to a deep vein thrombosis. To complete my assessment, I would check her vital signs, perform a full cardiorespiratory examination, including an assessment of her leg swelling, and calculate her Wells score.
Check out the Geeky Medics collection of over 1,000 OSCE stations. You can practice with friends using our group study mode or chat with our amazing AI-powered virtual patients.